So one of the questions from online came about it through our online listeners is random biopsying versus MRI biopsying. So there's new technology out here. I've talked about the transrectal ultrasound office-based biopsying, but now what we're starting to see, and it's been around for a couple of years, is MRI guided biopsies. And the way that these work is a patient will go get an MRI of his prostate, and then the MRI, about 70% of the time, will identify the cancer. Using very advanced machines, we can literally take the MRI image, put it in our ultrasound image while we're biopsying to literally biopsy that lesion, okay? So we can see the cancer on the MRI if we can't always see it, and biopsy the actual lesion, which is revolutionary. It's state-of-the-art ways to detect prostate cancer. The biggest limitation is that most centers around the United States can't read the prostate MRI. It's a very complicated study. Guys don't have a lot of experience reading these yet, and it's very difficult to call the lesions on MRI. It's something like 1,200 images these guys have to look at to find 5 millimeters of cancer. But I think that, again, is a new revolution or the tip of the iceberg of how we're moving forward. So we're moving away from the ultrasound guided biopsies to MRI fusion guided biopsies, and that's just the start of the future. Yeah, MRI technology is new and it's a challenge, and it's state to state. Sometimes they're not covered. Usually they're not covered with diagnosis of elevated PSA. Typically you need a diagnosis of prostate cancer. It's a challenge we face. As men, we got to speak up to, politically to make sure that we're getting the appropriate test. Prostate MRI is very expensive. It's new technology, still being tested. There are definitely challenges for getting these approved, no question, and it's payer dependent.